Hi everyone, my name is Kelly Poppaw. I teach the Finding Dysfunction class. In this class, we cover joint dysfunctions, muscle dysfunctions, fascial dysfunctions, and compensation dysfunctions. We call that the JMFC framework. We want to show two of the techniques that we use at the ankle and why when someone has decreased or lack of dorsiflexion. So in the clinic, you might actually see the patient when they're squatting, when they're walking, putting them in single leg balance, that they have an overpronated foot or excessive pronation. So that's a compensation. So that's kind of that last ring of the JMFC framework. So when we see that, one of the reasons why someone could have a overpronated foot is because they have a lack of sagittal-plane motion at the ankle, or dorsiflexion specifically. So two joints that we look at the ankle, the two main joints of the ankle complex, are the distal tibiofibular joint, okay, so that lateral malleolus, and the talocrural joint. Both of those joints move in the posterior direction or do posterior glides for them to restore ankle dorsiflexion or sagittal plane motion. Doing that decreases the compensation of the foot going into too much pronation. One of the things I wanted to highlight, though, is why we start with one of the joints before the other. So we actually start by mobilizing the distal tib-fib joint first before we mobilize the talocrural joint. And it comes down to just anatomy and just order of operations of how things move. So when we do the posterior glide of the distal tib-fib, I would bring his foot into end range dorsiflexion, use a little cup grip with my hand, but put his lateral malleolus right here between the thenar and hypothenar eminence. And then as I passively bring him into end range dorsiflexion, I'm just going to glide his lateral malleolus in the posterior direction. Okay. So naturally, the lateral malleolus should sit posteriorly to that lateral lip of the talus. The talus is kind of a dome shape like this. And if this is the lateral edge of the talus, medial edge of the talus actually is pretty straight up and down on the medial side, but it flails outward on the lateral edge of it. So the lateral malleolus sits posterior to that little lateral lip of the talus normally. So anatomically, that's where it sits. When you have a lack of ankle dorsiflexion or a relatively plantar flexed foot, sometimes that lateral malleolus can get shifted anteriorly and inferiorly. So the posterior glide, and even kind of angling your hand a little bit superior with that too, so doing a posterior and superior glide is really beneficial to restore the optimal position of that lateral malleolus and improve the distal tib-fib joint glide. Okay, so we would do that posterior glide, and then after we restore that position, we would go into a posterior glide of the talocrural joint. So lots of different ways to do that. Use what works for your hands. This is one of the ways that we do it. We cup the foot, we bring him into end range dorsiflexion, supinate the foot slightly, and then do a posterior glide with a little bit of a scoop so that we don't lose that end range dorsiflexion. Okay, I could do this in the seated position, standing, split squat, whatever feels best for my body. Okay, so off of his body, bring him into end range dorsiflexion, slightly supinate, and then posterior glide with a little bit of a scoop so that I don't lose that end range dorsiflexion. I'm also not coming on, off his body. I'm bringing him to the end range and then mobilizing, either oscillating or sustaining at that end range. Okay, so that's two different techniques to restore ankle dorsiflexion and decrease the compensation of overpronation at the foot.